Welcome to my educative channel. I'm Dr. Teardrop, plastic surgeon. I specialize in minimally invasive procedures for facial rejuvenation using laser technology. Generally, patients between 40 and 60 need a facelift, but many patients ask, when is the correct time for a facelift? There is not age for a facelift. The time for a facelift is when the patient don't feel good, the patient lost the definition of the mandibular branch, lost the definition of the neck is sagging, this tissue is sagging. This is the time, but sometimes the patient do not perform these kind of procedures for different reasons. One of the reasons are the scars. Here we can see, we have not seen scars, because it's a special technique that I developed in order to avoid to make an imperceptible scars. Another thing is the movement of the sideburn. Here we can see there is no movement of the sideburn. It's in the correct position, the natural position. The other is the deformation of the earlobe. Here we can see an earlobe in the good position. And the other is the anti-naturally of the procedure, anti-naturally of the face. When you see a patient like this and you don't realize that this patient has a facelift, it's a good procedure. And you can see almost 2,000 educative videos, and no one you can see a natural result for everything, for eyelid, forehead, nose, lips. I'm minimalist. I like a good result, nice result, but no excessive. No excessive. I like to make a full facelift, endobrow, brow lift, but all this, when you put it in a minimal expression, it's perfect, because I work in all aspects of the facial aging. I generally try to convince the patient to perform an brow lift that I perform with 3 minimal incisions, my personal technique, and eyelid blepharoplasty that also I perform without skin resection. Full face laser rejuvenation for me is fundamental. When I perform a facelift, always I try to convince the patient to remove the wrinkles, because if you put in a nice position of the face, the neck, the eyebrow, everything, but the patient is full of wrinkles, the result is not complete. It's not complete. And also I find very important when I perform a facelift, if the patient have a reduction of the chin, put a little chin prosthesis beneath the chin here, with a small incision here, improve a lot of the result. And also from the forehead, generally I tighten the tip of the nose, because when we get older, the nose is going down, and I take the opportunity of the endoscope brow lift to go to the tip of the nose and put a little bit up. And here we can see the definition of the mandibular branch, the neck, and you can see this. The expression of the look is very important because this patient look younger, here look tired, old, sad, and here is the opposite. I tried in all facelift perform this one. I received many patients from outside of the country, and they don't come to Argentina only for a facelift. When they come, I perform everything. If I perform only a facelift, they only need to stay 8 days. But if I perform the full face, generally they take 15 days. This procedure I perform under local anesthesia. It's ambulatory. The local anesthesia is plus sedation, and generally the patient goes home in 4 hours after the procedure. But if the patient I perform that come from outside, I perform a facelift and the patient come alone, generally they stay 1 day in my clinic. Here we can see small chin is very nice to improve, and the lift of the tip of the nose. Generally patient this is very impressive. No, it's not. You can see the lift of the tip of the nose. You can see the action of carbon dioxide laser, the traction of the forehead and the eyebrow with some types. And here is 24-36 hour post-op, and this is 24-hour post-op. And this is how the patient feeling, and you can see how improve the expression of the look, the mandibular branch. This patient take a photo in their home. This is 6th day. You can see how improved the nose. Okay, I hope you enjoyed this presentation. See you in the next educative chapter.